Joining us now is Tracy Wodatch. She is the president and CEO of Connecticut Association for Healthcare at Home. And Tracy, good to see you here in the program.
Well, thank you so much, Dennis, for having me.
So first of all, tell me a little bit about your organization.
Yeah, so I'm the president and CEO of the Connecticut Association for Healthcare at Home. We're a nonprofit member organization that supports care at home providers, specifically skilled home health care. If you are in the hospital, a nursing home, you come home, you need some rehab, therapy, nursing, we're there to help you, and that's predominantly paid by Medicare, some Medicaid, and commercial insurances. And then we also support our hospice providers in the community who need end-of-life care, our hospice patients in the community who need end-of-life care, and that's predominantly paid by Medicare as well, a little bit of Medicaid. The last big population that we support are the providers of support care at home. And that's people who just want to stay in their home. They don't have any medical needs, so to speak, but they really need some added support,
some help,
some personal care, some meal prep, some homemaking to stay there and not have to go in an institution.
Let me ask you this, because we've seen such a proliferation of home care companies in the last 5 years or so. Why is that?
Well, we've seen a proliferation of them, but we've also seen a decline because the Medicaid coverage for them to be able to continue to provide services causes many to go out of business. So at the same time, we have investors coming in to try to keep that business going because it's so needed. AARP does studies year on year, and for the last decade, it's shown that about 75% of people 65 and older want to stay in their homes, and we have a booming aging population.
Yes, and so how do you handle that aging population?
So
what are the challenges?
The biggest is the workforce,
yeah,
and the ability to pay the workforce. Private pay cases bring in a little more money, but Medicaid offsets that by not being able to reimburse the providers much to even cover their costs.
Where do Medicaid rates state right, where do they land right now in 2025 in terms of, are they going up?
No, they are not. The
so
budget was released.
Not going up.
Yeah, budget was released today. The rates have not gone up for the skilled home health in over 2 decades. For our care at home, they've only gone up mildly due to minimum wage increases. And we have about a 52% inflationary rate from the last time they went up in 2007.
So a recent study shows that Connecticut actually pays less than a lot of states to home care. How do you get that changed? What are you working on to get that, to persuade lawmakers to maybe do something different?
And we've been knocking on the doors as much as we possibly can. The Medicaid rate study fell short for home care. It showed that we're somewhat comparable to the states that are around us, but it only measured a few of our visit codes. So it fell short.
If you could talk to your state lawmakers right now, talk to the governor and say, here's what I need done to help people across the state, what would you tell them?
I would tell them that we are the proven cost saver of health care. Keeping people in their homes over the last 15 years has saved the state $2.5 billion. Invest in us. We are the fiscally responsible investment for the state, and we are the preferred choice for people wanting to age with dignity in their homes, not in an institutional setting.
Tracy Wodatch, she's the president and CEO of Connecticut Association for Healthcare at Home. I want to make sure I get all those words in the correct order. We appreciate you sharing your insight today.
Thank you very much.
Thanks for watching. I'll see you tomorrow on the 6 o'clock news and at 11. Capitol Report coming up next.